Ma, please can you educate us on how to prepare our body, especially our womb, for conception? A lot of us have been trying to conceive, but it's not happening. Is there things that we need to do before we try to conceive? My name is Tochi, and you are watching Tochi Fertility Channel. Please share this video and receive your blessing. Before I dive into this video, I want to put a disclaimer that I am not a professional, I'm not a medical practitioner, I am not an expert. I am only a woman who make research and try to impart knowledge on women trying to conceive. If you have any issue regarding your health, fertility, please endeavor to contact your physician for proper medical checkup. Now, I have been receiving series of this question. A lot of women trying to conceive, they are asking me what they need to do or what they need to know, the processes and what they need to do before they start trying to conceive, or even when they are trying to conceive. And I believe the people asking me these questions are my new followers, because I get a lot of new followers every day. So that is why I am here to answer this question. Pregnancy is a process. For the fact that you make out and you find yourself being pregnant doesn't mean that it's easy. It is a process, especially when you are up to 35 to 40 years. You need to take some steps. You need to do some certain things to help yourself. The first step, like I always say, is to go for what is known as preconceptional test. This means that you want to become pregnant and you need help. You have to go for a test. Contact your doctor, contact your physician, contact your healthcare provider, contact your gynecologist. A lot of women trying to conceive, they shy away or they run away from their fertility doctor, from their female doctor, but these people are supposed to be your friend. When you go to him or her, he will conduct what is called preconceptional test. And what will he do? He will check your womb, he will check your cervix, he will check your hormones to know if you have any issue. He will check everything checkable to make sure that you are okay to carry pregnant, to know if you have anything that will hinder you from becoming pregnant. So if you are watching me right now, you have not visited your gynecologist for preconceptional test and you are planning to conceive, my sister, please endeavor to do this. This is the number one step. The number two is to check yourself if you have infection. You know, when you are telling people about infection, they don't understand it. They take it for a joke. If you have any untreated infection, it can lead to serious infertility. Infection can block your fallopian tubes. Infection can cause hormonal disorder. Go and ask your physician about this. So you need to contact your physician. You cannot shy away from this. You cannot run away from this. You are not a medical practitioner. You are not an expert. You cannot do it on your own. Remember, at the age of 35, your hormones are deteriorating. Some women have hormonal disorder. So until you visit those people who study this, they will check you and make sure that everything is okay. Not only getting pregnant. For example, if you have infection or any untreated ailment and become pregnant, you are not going to find it funny with that pregnancy. You will even blame yourself why you become pregnant. So now that you are starting, is it not very good for you to contact these people who know more about this, instead of most of you going online asking people, what can I do? How can I do this? Why the professionals are there? I always encourage people to go to their doctor. I am only here to teach, educate you, and I tell you to go and visit your physician for proper medical checkup. So the number one is you go for preconceptional test. Number two, check for infection. These people who will conduct preconceptional test on you will also do a test either by urine or by checking your cervix or anything checkable to find out if you have any infection. Then they will prescribe medication treatment for you, not the ones you seek online. The number three is you do what is called detoxification. These people will also guide you on doing this. It's very, very important. The number three is you take your prenatal vitamins. Did you hear me? Prenatal vitamin is very essential for every woman trying to conceive. You need to start taking this before 3 months before you even try to conceive. When you talk about prenatal vitamins, people do not get it very well. Some people will tell you, I am taking this, should I take prenatal vitamin? I have this, should I take prenatal vitamin? Come on, go to your physician, go to your doctor, go to a pharmacist, the qualified professionals. They will prescribe prenatal vitamins. The most needed vitamin there is folic acid. Folic acid contains what is called folate, which is good for a woman that is trying to conceive and also for a pregnancy woman. So, if you want to get prenatal vitamins, meet your physician, meet your gynecologist. These are female doctors that see to the affair concerning women. So, go to them. They will prescribe prenatal vitamin for you. Have money for that, they can prescribe folic acid for you to be taken 3 months before you even try to conceive. The next thing is you should know your fertile days. Know your fertile days. Very, very important. A lot of women watching me right now do not know how to calculate their cycle, but they want to become pregnant, but they are preparing to become pregnant, but they don't know when this pregnancy can occur in their system. They don't even know that there is a time in their cycle that permits them to become pregnant. It's not every day in your cycle that you can become pregnant. There are specific days that your body is ready to carry pregnancy. So you can go to Facebook, go to search engine, go to YouTube, social media platform. Why I am so angry about some people is that they don't watch something that they can benefit. They don't watch things that can impact their life. These people have a problem. Instead of making research the way I make and try to teach you, go and make research. Go and study how to calculate your cycle. You can ask your doctor, but most of them might be busy. They wouldn't have time to explain it the way I am explaining it. You can ask them. The good ones that have time can mellow down to explain, or they can even use ultrasound to track your fertile window. It's very, very important. You have to know when you are ready, when your body, you have to know when your body is ready to carry pregnancy. If you are watching me right now, you are trying to conceive, you don't know when you are likely going to become pregnant. Your most fertile day and the fertile windows. We have fertile window starts 5 days before the most fertile day. That is making it 6 days. Go and study these things in Google. Go and watch people's video on YouTube, Facebook. They are there. Use your phone to help yourself. Most of you like watching gossip, something that is meaningless. Why not educate, get information? Information is power. When you are not informed, you'll be deformed. So go and learn how to calculate your cycle and also know when your body is ready to carry pregnancy. Another one is that you should limit the intake of caffeine. I didn't say you should stop taking caffeine. I see a lot of people, especially students, they can take 5 glasses of coffee a day. 1 glass a day is okay. Until maybe when you finish giving birth and breastfeeding, you can continue. If you are taking alcohol, my dear sister, stop it. If your partner is taking alcohol, he should stop it, because alcohol reduces the quantity of his semen and even the motility, the movement of your partner's semen. So let him stop it. And again, learn how to cope with stress. I wouldn't tell you to avoid stress, because stress is unavoidable. Myself here, I pass through stress, but I have learned how to cope with it. When my head is full, I know what I can do to cope with that situation. Our world is stressful. You cannot avoid stress. You cannot stop it, but learn how to cope with stress, because when you are stressed off, your brain and your uterus will cut communication. It may affect your ability of becoming pregnant. Ask your physician. And also, if you are overweight, try to reduce. If you are underweight, you try to add up weight. Overweight can cause you not to become pregnant. It may make you not to OV. So all these things, and again, age matters. Age matters. When you are up to 35 years, you start having some fertility issues, because this is when the period of hormonal imbalances surface. So if I will advise, if you are a young lady that is not married watching me, my dear sister, I will advise you to go and get married early, so that you will start having children and escape this problem of infertility or finding it difficult to become pregnant. I believe I have done justice to this video. If you do not understand me, come on, ask me question in the comment section. Like and follow our page. Subscribe to support me if you like what you have just watched, and God will bless you.